My name is Sherry Reeves, the Executive Director of MACF. As you all are aware, businesses, large and small, can greatly influence our community's awareness and readiness against the spread of the coronavirus. The information is changing daily and sometimes hourly in regard to the coronavirus. Today's GoToMeeting webinar is presented by Florida Makes, and I would like to thank them for this platform. I'd also like to thank Christian Davison, the Director of Marketing and Communications with MACF, who is running the webinar. Today's webinar, What Employers Need to Know About COVID-19 Virus, is presented by Wendy Sellers, the HR lady. At this time, I would like to turn it over to Wendy.
Be nice if I unmuted myself, huh? Alrighty, let me get my screen all shared here. Can you see my screen? PowerPoint?
Yes, Wendy, we can see.
Okay, so let's get started here. Let me hide this so I can see my screen. What we're going to go over today is what we know about the Families First Coronavirus Response Act. A lot of information was, thrown at us at one time. It's very overwhelming, and I would say, you see that I have here as of March 26th, and the reason I'm dating everything that I publish is if you find anything before the 25th, it may not be accurate. And the reason is the law was passed on March 18th. We were told that it was going to go into effect on April 2nd and that you can start implementing things before then, so between the 18th and the 2nd. And then on the 24th and the 25th, the Department of Labor came out with new information that said, nope, forget that. So if you find any information out there from anyone, including myself, that does not have the date of March 25th or later, it may be inaccurate. Because the Department of Labor clarified a lot of information after the fact. And so this is what we're going to go over. We're going to go over the Act, family and medical leave requirements, so paid leave requirements, tax credits, and unfortunately layoffs and unemployment. So this is the important information that you need to know is this law, the FFCRA, offers paid leave, so paid sick time, for yourself or for your family or for your child if you are out of work for one of 6 reasons, and we'll go over those reasons shortly, due to the COVID virus. This is specific to COVID-19 from April 1st and ends December 31st. So unless they extend it at the end of this year, these rules are gone. So everything that you've learned, you'll have to unlearn. The employers, so everybody on the phone here, you have to comply with this by April 17th, and that's when they're going to start implementing fines. So they're giving us some leeway to either attempt to comply or try to do the right thing. So that's why you're on the call today. This is for all public agencies, which are considered government employers. I'm not going to get into too much of that today because I don't think we have that many or any on. And if we do, you can call me afterwards. This is for all private employers with less than 500 employees. So if you have basically 2 to 499 employees, this FMLA and the paid sick leave now applies to you, which normally the FMLA only applies to employers with more than 50 employees who have been with the company for more than 1 year, and that has changed as well, just for the COVID. If you really want to go into the 90-page bill, it is in here. I've done that for you, though. We're not going to get too deep into the specifics because we could be here for hours, and I know nobody has time for that. So I'm going to try to give you a very high-level overview and then answer some questions at the end. And then if you really needed more help and assistance, we could connect. So who has to comply? 1 to 499 employees. It's really 2, because if you only have 1 employee, you're the owner, and that means you can't get unemployment, although they're making some concessions for that too. The big difference here is previously FMLA only covers employees who've been with the company for 1 year. Specific to COVID, change that to 30 calendar days. Can you mute everybody else? I think we can hear people. So we have to make sure that it's anybody that's been on your your paychecks, really, even if you only pay them once, if they're in your books for 30 calendar days as of April 1st, they now qualify. So I encourage you to get with whoever does your payroll, because there's a lot of things there that, I personally don't handle. I know enough to be dangerous. So if they have been there and they fall under one of the 6 reasons, they're going to be protected for up to 12 weeks. There is one exception to this. The exception is employers under 50 employees. Unfortunately, we don't know how to get that exception yet. So that's one of the last things that has not been clarified yet. So I definitely encourage you to connect with me on LinkedIn, and I'll give you my information at the end of this presentation, but I'm easy to find, Wendy Sellers, as I'm posting information as it comes out. So here is the Expanded Family Medical Leave Act. Again, April 1st to December 31st. The reason I'm breaking this down is that in this bill, the Families First bill, there are multiple sections. 3 of the sections apply to employers specifically. It's Expanded Family Medical Leave Act, and then there's a sick paid leave, and then there's unemployment information as well. And then a lot of this, when you're reading it as separate sections, it conflicts with each other, and that's where the confusion is coming in. So this is the Expanded Family Medical Leave Act portion. So we might be able to get some exclusions, but since we don't know how to get those exclusions, if you have under 50 employees, I would just assume right now that you qualify, and then we'll figure out later. Hopefully they'll come out with a definition or forms they have a definition, but it's so vague, it still you don't understand, like, okay, how do I prove that I can't afford this? 30 calendar days. The job is protected for leave for one of the 6 reasons, including out of work due to childcare or not having childcare. That has never been in the FMLA before as well. So this will go away at the end of the year. Family, as defined by the FMLA, is son, daughter, spouse, parent, and loco. Why I think this is important to say is the original bill that then got revised included other definitions. So this is the final definition, which is the regular FMLA definition. Again, we don't know how to exclude or exempt the employers with less than 50 employees. It basically is saying, you're going to have to prove to the Secretary of Labor that you cannot afford these requirements, and it's really vague, and so we're waiting for more information. The somewhat good news here is it does say right in here that employers under 25 employees do not have to hold their job open for someone who is on FMLA. They still have to comply with all this, but because they're small and maybe they're busy, some organizations are actually really busy now because of COVID, and somebody takes leave, you have to let them take the leave because they don't have childcare or one of the other reasons. But if you're under 25 employees, you don't have to hold their job open for them. So if anybody that is on the phone doesn't normally use FMLA, FMLA basically means that an employee can go on leave for certain reasons, and you have to let them go on leave for 12 weeks. Some of it's intermittent, so a week here or a day here. And then during their protected time off, you cannot fire them or replace them, with very, very few exceptions. So this is definitely making it a little bit more difficult for small employers or just employers that are busy as well. So now there's another section of the FFCRA, which is called paid sick leave. And again, they overlap with each other, and the wording sometimes conflicts each other. So I'm going to try to break it down here. So the paid sick leave part says any employee that and these are the 6 reasons below, it qualifies for paid sick leave, If they're unable to work, either you don't have, maybe you don't, they just can't work because one of these 6 reasons, or they have to work in the office or in the plant. They're not able to telework because of one of these 6 reasons, then they get paid leave. And I did a spreadsheet for my clients, and I took a screenshot of it, and I'm going to show it to you, where I try to do the crossover and explain it a little bit more. So the first reason of the 6 reasons is the employee is subject to a federal, state, or local quarantine or isolation order. I have a question mark after that. It has not been clarified what that means. So some of you that are on the call today have been affected by county or local shutdowns or stay-at-home orders. Does number 1 qualify for that? We don't know. The assumption by most lawyers and HR professionals is yes, but it has not been specifically clarified by the Department of Labor. So my advice is to say yes. I'm always going to advise go above and beyond, so later on you don't get in trouble. Second thing, the second and third thing kind of go together. The employee has been advised by a doctor to self-quarantine. The employee is experiencing symptoms and is seeking medical diagnosis. So the employee themselves thinks that they're sick with COVID, or their doctor told them that they might be and that they have to be in quarantine. That qualifies them for paid sick leave. The fourth one, which is a little more, fourth and fifth and sixth actually aren't really clearly defined. The fourth one is family members. So I'm going to go back one screen here. Remember, family, son, daughter, spouse, parent, and local. So if they're caring for a family member who is sick or thinks they're sick and is seeking medical diagnosis, then they can take time off of work and get paid for it, and their job is protected during that time. The fifth one is if the employee is caring for their child whose school is closed, which pretty much every school is right now, and they don't have childcare. So they can take time off of work and get paid for it. There is a caveat on that one, and this one is the one that's probably most financially painful to employers, is they get it longer than the other reasons, and we'll go over that. The sixth one has not been defined yet, so it's pretty vague. The employee is experiencing a substantially similar condition to COVID. What does that mean? No idea. I'm sure they're going to come out with that, but I have a feeling it was kind of a catch-all to say, hey, we don't know where this is going to go, and another illness may come out of this. So we want the employees protected. So these are the 6 reasons. I'm going to show you a Department of Labor website, and there's fact sheets that they put out on the 25th. And so what I would suggest is to print them out and make sure you're firmly familiar with these 6 reasons. These are the only 6 reasons that they can get paid leave, and then also the FMLA protection. So if you don't have work, that's not one of these reasons. That goes into unemployment. So that's very important to know. So the Department of Labor, again, updated their information on the 24th, and then they updated it again on the 25th. I'm going to go to the site right now, see if it opens up. I already have it open. If you guys have been here at all, you'll see that it's changed in the past 2 days. It changed on the 24th, and then it changed again on the 25th. There is some really great information here. I would get to know this site, make this site your friend. Yesterday, I kept refreshing it all day until new information popped up, and it did. And so you can give this information if you wanted to. You don't have to. The employee paid leave rights, the employer paid leave requirements. And what I want to show you right here is these posters. So the one that says employee rights, there's a poster. I'll click on it. And you have to download this and put it in wherever in your break room is where you usually have all your other posters. And if you have any remote workers, you need to email this to them. If you have an intranet, you can just put it on your intranet, but if you don't, so make sure you do that. This is part of the law. It's required, and it's telling the employees what their rights are. So when they see this poster, it's probably going to open up a can of worms for you. Get to know this information before you send that out and put it up. You have to put it up by the end of March. Let's click on the employer paid leave requirements fact sheet. I say that it's clear, but it's probably not clear to everybody. So generally what it's saying is, hey, it doesn't even say that these provisions will apply from the effective date. Well, the effective date has been changed to April 1st. So, make sure that you know that. The Act provides that all employees get this paid if they qualify for one of the 6 reasons. 2 weeks of paid sick leave, and you can see here that it says 2 weeks up to 80 hours, because if your regular work schedule is like only maybe 32 hours for full-timers, then you're only going to have to pay 64. So you have to go with your regular schedule. This also qualifies for part-time employees. So if you have a part-timer that over the course of 2 weeks only works maybe 44 hours, then the 2 weeks for that person would be 44 hours. So hopefully you're catching on here. And so there's some payments are at the regular employee's rate, and then some payments are at 2/3 or 67% of the employee's rate. Again, I have a screenshot of my spreadsheet that I give to my clients coming up, I think, in the next slide. So this hopefully will make a little bit more sense. We already covered this part, all employees that have been with you for 30 days. There's another payment here. So this is only for the child care that you're going to have to pay your employee who is out of work because their child is out of school. You're going to have to pay them a total of 12 weeks. So 2 weeks from the top section, 10 weeks from the bottom, but it's reduced to 67%. All of this is credited back in a tax credit. Again, I would really advise talking to your accountant about how your payroll is set up. Generally most people are filing a 941, but some people may not be doing that. They may be set up a different way. And so you're going to need to talk to your accountant and whoever does payroll to understand how you're going to get this back. The Act says quarterly. I'm really hoping in the next couple days that they're going to come out, they being the Department of Labor, Wage and Hour Division, and the IRS and the Department of Treasury. I'm hoping they're going to come out with something that's going to get the employers their money back quicker than the next quarterly payment for 941s, which is like July. And so, because this is putting a huge hardship on employers. So again, I don't have that information. A lot of my peers that are in accounting and payroll or have been on a lot of webinars, and nothing has been released as of yesterday. Today is a different story. So we're going to go over who's covered. We already kind of went over that. Again, qualifying reasons, I've already listed that. Here is an important thing down here too. This again is on the Department of Labor website under the employer paid leave fact sheet. And then it kind of goes over even more the duration of leave. So it depends on what the reason is. So I'll try to show it so it's both. Depends on what the reason is. So for reasons 1, 2, 4, and 6, you have to, so if somebody comes to you and says, hey, I've got to be out because I think I have COVID, and then even if they get tested and they don't, it's a CDC order that everybody has to self-quarantine. So during that time while they're waiting for the test results to come back, even if it comes back negative, you have to pay them 100% of their pay for 2 weeks up to 80 hours of leave. Actually, it's 100% for one and 67% for another, and that's down here. And then for the child one, it's up to 12 weeks, so it's a lot longer. And then here's the calculation of pay. I'm going to skip back to the presentation because this is probably blowing your mind right now. And then that way we can see my spreadsheet and hopefully it'll make a little bit more sense. Again, get familiar with this website. There's the employee paid leave rights. I can assure you that your employees are probably downloading this. The employers, there's facts, questions and answers about fair labor standards, family medical leave. This is really important if you've never had to deal with family medical leave. So this explains what it is. There's some questions on here for, oh, well, what if my employees say, I'll just volunteer? And I've already had employers say that they've let their employees go because there's no work. And they're like, well, I'll just help you out. Well, technically, you really can't do that. And while at the time when you're desperate, it seems like a great idea, desperation breeds lawsuits. And so I always say, remember, we don't know how long this is going to, stay in our community. So if it's not cleared up in the next couple months, and employee A, who was like, hey, I'll volunteer, is still out of work for 6 months and can't find a job anywhere else, they're coming back to you with an FLSA lawsuit. And not because they don't like you, because they're desperate and they have to pay bills. So just get to know these answers and questions here. It's really helpful, and I'm shockingly surprised that they were pretty factual in here with the answers and questions. Make sure you download the posters. If you're a federal employee, there's a federal version, and then there's also frequently asked questions as well. So let's jump back to my presentation. Also, if you go on my website, on my blog, I'm posting information, trying to put a lot of this in layman's terms every day. So I have a bunch of posts there that then have links to other government agencies so that you can kind of follow it along. So here's the overwhelming spreadsheet. Let's start at the top. So week 1 and 2. So this is for sick leave. If you're sick with COVID or given a government isolation order. So this is the employee. If your employee does not work, the employer pays up to 80 hours. The employer submits for a quarterly tax credit, as we just discussed, and it's at 100%. For reason number 6, which is the other substantially condition, which we don't know what that is yet, you can drop their 100% pay to 67%. Now there is a in the law itself, there's a line that says that the first 10 days can be unpaid, and during that time period they can use their regular time off if they have it. What I'm trying to get clarification of is that the first 10 days from the time the law was signed on March 18th or from April 1st. So I will put that on my LinkedIn later today. So make sure that you connect with me on LinkedIn, and then I will also put it on my blog, well, assuming I have an answer later today. As of now, this is how it is. And so we want to make sure that you got this straight. And the other thing is, you, the employer, can't get the tax credit back until you pay them. So you're always going to be, you're going to be 2 weeks behind financially. So you're going to be paying out the 2 weeks. So let's just say your employee is sick with COVID, and they take April 1st to April 14th off, in theory. On April 15th or your next payroll period is when you can submit for the tax credit. So you're always going to kind of be behind. You're loaning it out, and then the government's going to give it back to you. How quick the government's giving back, I don't know. There's a lot of chatter that they really are trying to move walls and move everything, but I haven't seen anything concrete of maybe a special form or submission. All I can see right now is with your next quarterly tax payment, which is 3 to 4 months away. So that's a long time if you don't have the money to float this. So for the employee who's sick, you just pay 80 hours and you get the money back. That's really what you need to know. They can take the rest of the time off under FMLA, but you don't have to pay them. Now, if you already have an employer policy that says, hey, yeah, you can take 4 weeks off a year, you just can't force them to use their time off before this 80 hours. So hopefully that makes sense. So this week 1, 2, 3, 12, it's a little fluid depending on what your policy is, and then also depending on this unpaid time off that is in the law that is not clear yet. So I'm sure I'm thoroughly confusing you, but hopefully you can see my notes here. So after you pay the 80 hours, they're still out for whatever the reason is. They can use your time off. I do have a blog post on my website about, hey, can I change PTO during this time? And the answer is yes, no, maybe, sort of. And so I would definitely make sure that you consult with a professional, by doing that. If you are saying I've got to change my PTO or close the doors, that's one thing. But if you're just saying I'm changing my PTO because my employees are taking advantage of me, that's not going to go over very well. And I'll be honest with you, if you're doing anything that negatively affects the employee during this time period, April 1st, really now and through the end of the year, I foresee that there's going to be lawsuits in the future because we are a lawsuit happy country. Does this mean that you can't lay anybody off? I mean, if you have no work, you have no work, right? And so documentation is super important right now. The other thing up here, what I want to say is for the employee themselves who is sick or under an isolation order, again, we don't know what the exemptions are for if you have less than 50 workers. So we're waiting on that information, but we do know that under 25 employees are exempt from holding their job. It doesn't mean they can't give it to them. They just don't have to hold it. And what that means for people that don't usually use FMLA that are on this webcast is a lot of times when somebody goes out on FMLA, especially if it's planned, you bring a temp in to replace them. But then when that normal employee comes back, the regular employee, the temp goes away and the employee comes back. So 25 employees or less are exempt from holding their job. They're absolutely exempt. And then 50, we're not sure how you get this exemption yet, or how you get the exemption for the child care part. The good news for employees are there is caps. So 511 per day, $5,110 in aggregate for this sick leave section. Moving on to the family leave section, it's very similar to the top section, except for you reduce the pay. So same reasons, if their family's sick with COVID and they're taking care of them, or seeking medical attention because they're taking care of them. So there's 80 hours or pro rata, meaning if your employees normally only work 70 hours, then you pay the 70, or if they're part-time, you pay the part-time hours. It's all basically the same rules, except for you can drop their pay from 100% of their regular pay to 67%. There is a lower cap, much lower cap, so $200 per day for those 10 days, up to $2,000. So there are caps, which is good for the employer, not that great for the employee. This one down here is probably the most complicated, but the easiest way to understand this one is if your employee's child is out of school and doesn't have a child care worker, which most don't, because even the child care centers are shutting down, and they may not have family members, they can get up to 12 weeks paid time off. And so it's confusing when you read the law or even the Department of Labor website, because the 12 weeks is actually made up of 2 weeks of the paid sick time and then 10 weeks of FMLA. But in the end, on the books, it's 12 weeks with a maximum of 60 days. So 10 sick days, 50 FMLA days. This is all reduced at 67% of the pay, and that you have to pay the employee, and then the government pays it back to you via a tax credit as of now on your quarterly taxes, unless something else comes out that they find a way to speed that process up. So, and then there's another cap here too, $200 per day. And then for the child care one, it's $12,000. So it's on one part of the law, it says 2,000, and another part it says 10,000. Remember, these two are combined, sick leave plus FMLA leave. One question that I get often asked is, can you take several of these? No, the cap is per person. So if you are sick and then your kid's out of school, or your kid's out of school and then you're sick, you get to pick one. And so with this one down here, while they're on child care, if they have PTO, they can use their PTO, if it's accrued, to make up the remaining, the 67% to 100%. And to be quite honest, they can do it up here too if you allow them to. It's up to you. This one is just mandatory. But the bottom line is if they don't have accrued PTO, they get this. So my concern here for many of you that are, especially for people that are in businesses that are still up and running because they're essential to the economy, is employees may opt to take this because they need to stay home with their children, or they want to stay home with their children, and you need them at work, and there's nothing you can do about it. It's their choice, not yours. So be very, very, very careful if you are, talking to your employees, begging them to work, anything like that. Just be very, very careful that you are not overstepping the law, and especially if you're not being discriminatory. So I'm going to move on to layoffs and unemployment because I know there's going to be a lot of questions that have probably came in the chat and that we can openly discuss. For layoffs and unemployment, again, this is all based on the Families First Coronavirus Response Act, not on the new bill that has not been approved yet as today, 3/26. If you are doing layoffs because you don't have the work, or for whatever reason, it's usually because you don't have the work, make sure that you are documenting, preferably in a letter, but it could be an email, a professionally written letter or email that says, hey, we're sorry, but because of the coronavirus and the effect that it has on our economy and our economic conditions, we have to either reduce work hours, and this is going to affect you. We have to temporarily shut down, and this is going to affect you, or we have to permanently or temporarily close or permanently close, and this is going to affect you. And so put it in writing so that, the employee could then take that for unemployment, because we like our employees and we want to help them out. So they can take that and upload it to the unemployment site when they file for unemployment. Encourage your employees to file for unemployment immediately. Making sure, every state is different. If you have multiple locations in multiple states, every state rules are different. So the states have their own rules for unemployment. Per this act, the states are not to charge the employer's unemployment account or increase what is called their experience ratings based on the claims related to COVID. So that's why it's also important to write that letter so that if something affects your account down the road, you can say, no, I had all these layoffs during COVID, and it shouldn't affect my experience rating. And hopefully you understand what I mean by experience rating, but the more people you let go and collect unemployment, the more you as the employer have to pay, because they basically say you're a risk because you keep letting people go. And it takes years for that to come down. So the good news is during this time period, that's not going to be affected. Currently, the federal law is told the states that if you have a waiting period for unemployment, some states have a week or two that the employee has to go unpaid, that they have to remove that waiting period effective April 1st. Some states have probably already removed it, and I don't know that for a fact. I don't work in unemployment, but I've been checking out some of the states that my clients work in, and most of them seem to have waived the waiting period and just said, okay, we already know this is due to COVID. We're not waiting for April 1st, but they don't have to. Most states allow partial unemployment as well. So if you want to reduce work hours versus completely letting them go, if they normally worked, say, 40 hours before, and you can reduce it to, okay, you're only working 20, and then they can file for unemployment for the rest. Now, what I don't know is, again, today is March 26th. The new stimulus bill has not been passed yet. It's been passed through one division of the government. It is not a law yet. As of today, there are some funds in there from the federal government to give additional unemployment monies above and beyond the state. I don't want to say what they are because it may change literally within an hour, or it may not. What I don't know, I'm assuming that the federal government is going to give unemployed people both the state unemployment and this ration that they're saying will last for 4 months, so they'll have double unemployment. How that's going to work, nobody knows yet. And then I don't know if the federal government, I'll call it a ration of unemployment, if that's going to go to partially unemployed or just fully unemployed. So the stimulus bill, which is called the CARE Act, is 800 pages long and was, just approved by one division of the government yesterday. So that may have changed too. So I haven't had time yet to go through the 800 pages. But again, connect with me on LinkedIn. Feel free to stalk me. I'm fine with that, and or my blog. I'm always trying to keep information updated. These are some additional definitions that you may need. Say if you are a healthcare provider, or if you are providing services to a healthcare provider. So as of today, we don't know. Like in the Department of Labor law, it says healthcare providers and emergency responders are exempt from having to comply with the sick leave and the FMLA. But they did not define what healthcare provider and emergency responders are. There is this website right here that healthcare providers are defined under the current FMLA, and all the lawyers are saying that this is what's going to be used. My concern is I'd really like the federal government to say, okay, yes, this is what's going to be used. Because if it is, it doesn't say anything about, keeping non-medical staff who work for a healthcare provider at home, and will they qualify for number one, or do you have to mandate them to come in? And so there's still a lot of what ifs. And then the one of the last things here is essential workers. Many of you that are on the call today are most likely essential workers. And so I advise you to go to the Homeland Security website and go to this link, and it defines what essential critical infrastructure workforce is. This was referred to by the president recently as well on March 16th, and this is what the guidance says. And so I'm going to scroll down because there's more information here. So it starts talking about identifying who they are. I know you probably can't, I don't think I can make this, I could make it a little bit bigger. It talks about if you're in healthcare, if you're in food and agriculture, so if you're in manufacturing, food and agriculture, dams, emergency services, there's all of these. Get to know if you are part of that. And then there's even further definitions. I'm just going to choose the food one right here. There's even further definitions there. What I would suggest doing is, if you are considered an essential workplace and then your employees, either all of them or some of them, are essential workers, if we have a government shutdown, I think there's, I lost count, I want to say there's 11 or 12 states as of this morning that are shut down, meaning stay at home unless you're an essential worker or you're going to the doctor or to the grocery store. If we have that nationwide, statewide, wherever you're going to be, you may want to pull together a letter to give to your employees to have in their car, just in case they're pulled over going to work, and then they can have it signed by somebody in an executive level at your company to say, I'm an essential worker. So this is the Homeland Security essential worker definition. Many states, many counties, and many cities are defining their own. So you may have something here and say, oh, I don't qualify, but maybe your city that shut down has defined their own, and now you have an additional qualification. Clear as mud. Again, this is my LinkedIn profile. I'm offering services, virtual services, for just $500 to help you through this if you don't have HR. I have a lot of forms and everything. And so I'm going to go back to this here, let it sit here for a minute. And then Christian or Sherry, if you can read me any of the questions that were submitted, this would be the time for us to go through it for the next 10 minutes or so.
Thank you, Wendy. We do have a question right now. This is for FMLA related to childcare. Can employees do alternating weeks with a spouse or other parent, or do the 12 weeks have to be consecutive?
That's a great question. So there's been no definition specifically for COVID, and on the Department of Labor website, they are, when you go to this FMLA questions and answers, so it says COVID and FMLA, it's explained here. I went through it and it basically says everything that the regular FMLA says, which means yes, they can use, it's called intermittent. And so, you know, I encourage you to allow your employees to do that, so that you at least, especially if you're busy, so that at least you can have them back in the workforce, and then, you know, work with, if you work with them, they're going to work with you.
Thank you. The next question, if you have regular business hours and a remote employee asks to work during non-business hours because of childcare issues, it seems the option is to agree to that, or they would fall under FMLA. Is this correct?
Correct. Yeah, I would, I mean, the laws are basically, I mean, even a lot of the guidance is saying, go above and beyond. This is the time to go and be above and beyond. And I'll be honest with you, I'd rather you go above and beyond than have them apply for this credit, because if once they use one day of this, they're now fall under FMLA, and now they can drag it out for 12 weeks. And I hate to say it, I know I sound cold and heartless, but many of you on the phone today are actually busy and need your employees there.
Next question, can you please tell me if PTO accrual is required to be paid out prior to an employee being allowed to file for unemployment?
No, it is not. And so generally speaking, I would go with what you normally do. So if it's in your handbook that you do it, then you should do it. However, you know, you might be out of money because you have no revenue coming in. And I believe I actually, I posted a blog on my website about that. And so the Department of Labor did, you know, post on their site about having to pay out PTO. So be careful. If you can financially do it and you normally do it and it's in your policy book, you should do it. If it's not in your policy book, just make sure you're not discriminating, that you're picking your favorite employees or male employees or female, something like that.
Thank you. If your business is on the government essential business list, do you need to check to see if you are on the state or local list as well?
I would, no. I mean, if you're listed, the federal overrules all for saying, okay, this is the minimum of the essential. The only thing that could possibly happen is maybe the local is saying, okay, and also this, you know, whatever it might be, is included and okay to go from workplace to workplace. So I'm in Florida, and I believe many of you are as well right now. Currently, our restaurants are open for takeout, and so, you know, if that ever changed, that might be a local ordinance that says, no, you're not, maybe Orlando's not open, or whatever, Miami, whatever it might be. So if you're on the federal list, you should be safe. If you're trying to figure out if you want to be on the list and you're not on the federal list, then yes, look to see if your local or state has different clarification of essential for their area.
You mentioned on the slide layoff and unemployment about documenting about reduced hours, temporary shutdown, closure. Are employers allowed to reduce pay or not pay earned bonus or commissions?
Again, it all depends on what your employer policies say, and you know what you've done in the past. So my rule of thumb, I can't answer that vaguely without knowing who it is and knowing your whole history and everything, but my rule of thumb is just don't discriminate. I mean, this is a time that none of us expected. I'm shocked that the wording that Department of Labor is using, it's very realistic and saying, hey, yeah, this is what we normally would say, but now we're saying this because this is a weird situation. So just don't discriminate. So if you're going to do it for one group of people, make sure that those group of people aren't all white men. And then you're doing something different for, negatively against everybody else. So my rule of thumb is try to be consistent, and do not discriminate. And sometimes it takes somebody outside to just look over your checklist to say, hey, how about this here? Because sometimes we get so much in the weeds that we don't even realize that we're unintentionally discriminating.
The next one, before we were an organization with about 100 employees. We have laid off our part-time staff, so we technically have 8 essential employees and about 10 to 15 employees that have decreased pay rates of 85%. Do we still have to comply with these regulations?
Yes, at this time, until we figure out how the employers under 50 get the exemption. So as of today, yes, with the little star by it, like we have to figure out how you get the exemption. And then if you qualify, then you won't have to comply. I'm hoping this information about how to get the exemption is out before this is mandatory, which is in a couple days.
There is a question about emailing the presentation out. I will say that we have recorded this whole entire presentation, so it will be available through the MACF website and on our YouTube channel. And we have also Wendy's contact information, and I'm sure she'd be happy to share this information as well with you guys as far as the slides go.
Yeah,
Are there any other?
I want to.
Go ahead.
That's okay. I just want to try to get the clarification here about the first 10 days being paid or unpaid, and is that from March 18th or April 1st before I send this out. And so if I change this slide, I will make sure that I put like up here, updated time and date. And so I'd rather, because I know what happens is we print this out and then we go by this as the Bible, and then it changed information. So we're still waiting for the Department of Labor or somebody to clarify 2 or 3 things. And I'm hoping to have that, if not today, tomorrow.
Are there any other questions to be written in at this time?
Thank you, Wendy, for your knowledge and sharing this valuable information to our manufacturers. We appreciate your time. Next slide.
Oh, you got to take it back. I think I have to.
I'm taking it back real quick. This next slide is given to us from Enterprise Florida. They are looking for manufacturers right now who are able to help with medical supplies that are critically needed. If you are a manufacturer who is able to retool and help supply any of these products, or if you are looking to have a critical infrastructure designation, Enterprise Florida is able to help you out. There's also websites and emails here on this slide for the person or persons to contact if you are able to help supply or retool to supply any of these critically needed medical supplies.
Thank you, Christian. Lastly, if your company has not been deemed an essential employer, please email me at Sherry, SHERRY.Reeves, REEVES, @MACF.biz. I'm happy to put you in touch with a local manufacturer who has taken the necessary steps for this process. Once again, we'd like to thank you and taking the time this afternoon. We'd like to thank Dan Sutter from Florida Make. He's our business advisor, as well as Christian Davison and I are here to help and assist. Please visit our website, click on government page where we are keeping that up to date. You can also follow us on social media for the latest news. At this point in time, if there's no further questions, we want to thank you for attending today. Thank you, Florida Makes, for providing this go-to meeting, and keep manufacturing and stay well.
I do have one question that just came in. Wendy, if an employee does
Okay.
not want to work due to being high risk, do you have to pay the 80 hours?
I'm sorry, if they don't want to work because of being high risk, if they cannot work remotely, I would say use your best judgment. I mean, if you already know that they have some conditions, and all those people that the CDC are saying, if you have any of this, you need to self-isolate, then yes, you should go ahead and pay. Is this decision going to change? Possibly, but at this point, you know, the CDC and WHO are trying to stop the spread of this disease, and the employers have to do their part in it as well. So also, I just want to close up by saying, remember, you do get this money back. So it may be a hardship temporarily, but you do get this money back.
Thank you again, Wendy.